Hi, I'm Dustin. Today I will show you what it's like to be a 21st century global leader and a professional nurse in the operating room. The OR or the operating room is one of the special areas in nursing profession. Join me as I show you a day in my life as an OR nurse and what are the competencies needed for this kind of profession. Okay, so first off, you need to know that an operating room nurse is also known as an OR nurse, a surgical nurse, or the newest term, the peri-operative nurse. We work in a highly specialized area in the surgical or procedure setting. We provide care before, during, and after the surgery. The operating room nurse can be a circulating nurse or a scrub nurse. The circulating nurse is the only member of the surgical team that does not require to don a surgical gown and gloves. On the other hand, the scrub nurse is the one that assists the surgeon in instrumentation and procedure process while maintaining a surgical field. So, are you ready? Here we go. A typical day in the OR starts with obtaining my assignment in the morning or a day before my duty. I also prepare for my assigned surgeries by gathering all the necessary equipment, supplies, positioning device, and other instrumentations needed for the procedure. In both the circulating and the scrub nurse, there is a collaboration that takes place by performing a preoperative surgical count. Yes, you heard it right. We count. Like how many sponges does an operation need? Like how many scalpel, forceps, needles, and other equipment. We also ensure that the area for the surgery is sterile. Do you know what sterile in surgery means? Yes, you're right. The area must be sterile before and during the surgery. You're in luck, students. My schedule says that today, I will be a scrub nurse. I begin preparing by cleaning my hands using soap and water to remove bacteria, viruses, dirt, and other unwanted substances stuck in the hands through mechanical means. Do you know what procedure is this called? You're right, it's hand washing. Then I will proceed to hand scrubbing, which would make your hands cleaner. You will learn this during your related learning experience in college. I also do the gowning and gloving with the help of the circulating nurse. Now I'm ready to assist the surgeon in passing over the instruments that he needs. Do you know what's the name of this instrument? That is correct! This pair of forceps is used to grab organs and other tissues in the body. It is important for an operating room nurse to have critical thinking skills and foresight. Sometimes, the surgeon does not say what instrument he needs. It is up to the scrub nurse to anticipate the equipment to be used so that the surgery can go on as smoothly as possible. It is also important to have keen attention to details. There are some instruments that are too small that can be easily missed during the operation. Having an undivided attention enables me to account all instruments and ensure that nothing is left inside the body of the patient. Yikes! One must also be a team player, someone who knows how to collaborate and communicate effectively with the rest of the healthcare team to successfully carry out what needs to be done efficiently and without undue stress to the patients and their significant others. Good thing I have been prepared and trained well by Riverside College to be competent in what they do. The right and excellent preparation is important. My dear students, remember, we are dealing with human lives and we can't afford to make mistakes. Oftentimes in my line of work, emergency situations emerge. Like this patient, for instance, his BP suddenly drops in the middle of the surgery. Now the cardiac monitor is showing a systole. What is an asystole? You're right. Asystole is also known as cardiac arrest or cardiac flatline. It indicates the cessation of mechanical and electrical activities of the heart. Now, the team will perform CPR.
Stop the operation. The patient experiencing cardiac arrest, perform CPR.
Perform CPR now. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Check the pulse, check the breathing.
pulse, no breathing. Continue cardiac compression.
Continuing cardiac compression, 1001, 1002, 1003, 1004, 1005, 1006.
Stop CPR. Normal sinus rhythm on cardiac monitor. With breathing, with pulse. Stable vital signs. Continue surgery.
Because of the team's quick response and right judgments, the patient's life has now been saved and the vitals are now stable. Now that the surgery is done, the circulating nurse will bring the patient to the post-anesthesia care unit. What a shift that was, students! I know that you can be a 21st century global leader and professional nurse too, because you are a product of Riverside College.